if parents suddenly come to know that the kid is having some kind of a malignancy, uh, what he should do, what the parent should do in this case?
So what I feel is ki, any childhood cancer should be, treated by a pediatric oncologist, pediatric hemato-oncologist, who is the expert in the field. Because, as I have mentioned earlier also, it is not just about, giving chemotherapy or deciding on radiation therapy or putting a child into, surgery. But there are a whole lot of things that go along with that, be it supportive care, the nutrition aspect, the palliative aspect, the psychosocial aspect. How it's not just about treating the child, it's about, we have to make parents comfortable and, give them confidence also. Ki, yes, childhood cancers are curable and we are there for you along the way. So, the most important part is like once they are diagnosed with malignancy, the parents should take them to the centers where the pediatric oncologist is available, so that the child can have a holistic approach to his or her treatment. So yeah.
So